Our next presenter, Dr. Elizabeth Goldblatt, has been a long-time educator, leading educator in the acupuncture and oriental medicine field. She is the chair of the Academic Consortium for Complementary and Alternative Healthcare and is going to be talking about a program funded through HRSA that is actually sort of a double integration of disciplines that are also working to integrate this emerging field of integrative health and medicine with regular healthcare.
Thank you, John, and good morning, everyone. I'm very excited to be sharing with you this particular project, mostly because we are doing quite a bit of emphasis of really trying to flip from being such a disease-based, fragmented system that is not team-based, collaborative, or person-patient-centered to one that more focuses on health and well-being. And I think we're all aware that globally, this is indeed what we actually need to do. So, what has happened, as John was mentioning, is that under the leadership of the University of Arizona, but in collaboration with several national organizations such as, and we have the acronyms here, ACAC, this is a group that I chair, it's the Academic Consortium of Complementary Alternative Healthcare, and then a group that's recently changed its name, but it was called the Consortium of Academic Health Centers for Integrative Medicine, that we received a grant of really looking at four major goals. But before I go into that, I think it's important just to look at this definition of integrative medicine. And it's defined as a practice of medicine, and we're adding in their health, that reaffirms the importance of the relationship between the practitioner and the patient, that focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic approaches, healthcare professionals, so it's very interdisciplinary and interprofessional, and disciplines to achieve optimal health and healing. So this is the definition of how we are looking at our particular project. And as I pointed out here as well, integrative medicine and health includes both conventional and then the licensed, what we are currently being called the complementary alternative medicine practitioners, may soon shift to complementary and integrative health practitioners. So I want you to meet the leadership team, and as you can see, we have a tremendous variety. And we are initially focusing on primary care practitioners and looking at how we develop meta-competencies in a curriculum in integrative health and medicine. So you'll take a note that already we're quite interprofessional. We realized dentistry was not on here, and it will be at our very next meeting. And I represent a group that has 5 licensed complementary alternative medicine fields, which is naturopathic, chiropractic, licensed acupuncturist or traditional Chinese medicine, direct entry midwife, and massage therapists or body workers. And HRSA, a HRSA staff person is involved as well. We've now been working since last fall. And here are our 4 major goals. We've already accomplished the first 2. So we did establish our leadership team. We already have developed the core integrative health competencies, and you'll see them in a moment. And while we're saying primary care teams, and we are focusing initially on primary care, already in doing our work, we realize that everything we're developing is absolutely relevant to all healthcare providers. So at some point, and we're hoping in our next stage, we're actually going to simply take what we're doing and expand it to all healthcare providers. We're going to be developing a 45-hour interprofessional integrative health online course that will be available to all healthcare practitioners. Then we're going to create an accessible and interactive online infrastructure, and ultimately we plan on developing patient education materials and facilitate access to integrative health practitioners. So these are people that are going to be focusing on health and well-being. These are the 10 meta competencies. And as you look through these, I think many of them you'll be quite familiar with. But for this particular group, I think what I want to focus on is number 3, where we're collaborating with the individuals and the families and the larger communities to look at really how we're going to create health, and also using mind, body, spirit, and approaches. And then we're also focusing very intensely on number 5, which is how can one work in an interprofessional team if you don't know about the other fields? So know about them, train with them, learn how to work together, and actually begin working together. Also, we're going to be working and training people how to work effectively as a member of an interprofessional team that's focusing on health and well-being. And 8 and 9, I think, are equally important. We spent quite a bit of time recently in the last 2 days talking about levels of burnout amongst healthcare providers, which is all healthcare providers. At this point now, we're at least 50%. And not only that, the suicide rates appear to be increasing. So our next project was to begin looking at the content. And we sent a survey out to a number of practitioners. We sent them out to all the primary care fields I mentioned, including dentistry. And we asked them to send it out to all their academic deans and their communities, or what are some of the most important content areas that we need to include, as well as obviously training to the 10 meta competencies that I mentioned. Oh, just shifting back for a moment, we asked each field that under the meta competencies, we wanted them to develop sub-competencies that were specifically relevant to their fields. Because we're not expecting people to lose the expertise in their fields. That's very important. So each of the fields that I showed up there has developed their own sub-competencies, which they will be teaching in their curriculum. So again, you can see all the different areas that we listed. The ones on the left are the ones that tend to be the predominant ones, but we do plan on covering all these content areas. And you can see we're really shifting the focus of how do we develop health and well-being, and very much taking approach now to less invasive treatment before more invasive treatment. We're so fortunate. We have all of our high-tech medicine around and hospitals around, but there's so much more we can be doing to really focus on preventative medicine, creating health, working with larger communities, and having a much more ontological view of how we approach health and well-being. So, oops, it was a duplicate slide. I'm so sorry. So you can see our ultimate goal here, that we want interprofessional collaborative teams that are patient person-centered and really utilize integrative medicine and health to develop their own health. This has to be truly a person and provider partnership, as we all know. And then lastly, you can see some of our goals are not dissimilar here at the Institute of Medicine. It's to break down silos, to really come together and strategize. And ultimately, what we want to happen is that for all of our respective fields to adopt these meta competencies, to go to their council of colleges, go to their accreditation commissions, in a sense, do a junior IPEC movement, so to speak, or maybe actually it's going to be a mega IPEC movement. And really, how do we flip from being a disease-based, fragmented, not a team culture, to one that focuses on health, wellness, well-being, self-care, larger involvement with the community, going out into the community, and using all the appropriate providers that actually should be accessible, including community health workers, traditional medicine, indigenous practitioners, and so forth. So the last thing I would like to mention is, again, while this started on primary care providers, as we've all gotten together and met, this is so clearly going to be relevant to all healthcare providers and community workers. So I think it's a whole broad range that this actually, as we move forward, we want this to be a national model, and we firmly believe that in starting a larger dialogue, this could really be transformative and a change agent. So thank you very much.
Thank you, Liza. I was curious in knowing something about the program, that your definition of primary care not only includes dentists and family doctors and advanced practice nurses, but also acupuncturists, chiropractors, direct entry midwives. How did you come up with your list of who you considered in the box there?
That's an excellent question. So I'm a healthcare educator. I am involved in education now since the 80s, and I'm not a practitioner, but I'm a grateful patient, actually, of many of the areas that we have discussed. And so not just the complementary, but conventional. And I learned a long time ago how to put together my own team. But I personally am much more interested in less invasive before more invasive, and I think many people are these days. And so I think a lot of individuals are thinking about disease prevention, about self-care, of partnership. So as many of you know, the University of Arizona had developed a Department of Integrative Medicine many years ago. ACAC, of which I am chair, has been involved with a consortium, which I mentioned, of academic centers of integrative medicine for several years. The University of Arizona is a member of the consortium. And I think one of the elements that we've been discussing now for well over a decade is how do we work together more, and actually even looking at all kinds of projects on which we can begin to collaborate. So of the 133 medical schools, I think there are about 133, over 60 of them now have departments of integrative medicine. And ACAC, including naturopathic, as I mentioned, Chinese medicine, and chiropractic medicine, for many individuals throughout our entire country, are considered first point of entry and are also in many states considered primary care providers. So this is truly a cutting edge model. It's the first time that I know of in history in the United States or in the globe where we have all of these practitioners now at the table really looking at health and well-being. So I think it was very broad-minded of both the allopathic medicine practitioners and of our fields to now truly be all sitting at the table. And the way we're able to do that is we are thinking about what is best for the patient, what is best for the person. Because if we truly want to develop collaborative, team-based, person-centered care, what begins to break down the turf is what is best for the human being, the person. Thank you, John.